Richmond Public School.
$99,816 people in this country have been killed by coronavirus. Some of their names are on the screen you see next to me. That number for Johns Hopkins University will rise. On average, about 800 people are dying every day, so within hours, perhaps within this hour or the next several hours, it'll cross 200,000. It makes you want to stop every clock on Earth. Instead, tonight we remember. The first recorded fatalities were back in February, and the projections show many more of us will die in the months ahead. Mask wearing and social distancing could have saved many of those lives on that list if more of us were willing to wear masks and maintain distance. The numbers are staggering. The list of names, staggering. It's easy to start viewing them as just numbers, but each is a person with a family and people who love them and miss them terribly. There are mothers and fathers on that list. There are wives and husbands and sons and daughters and beloved grandparents. There are doctors and police officers and musicians and teachers and nurses. They're as young as 5 months old. Some are more than 100 years old. Over the next hour, we're going to show you as many of their names as we can. We pulled them from our own CNN reporting as well as local and national listings from all over the country. That list that we are showing you, that's just a fraction of the 200,000 plus people who will have died. In fact, to show all their names, even if we knew them all, would fill every hour of this program for the next 2 months. We wish we could tell you all their stories, show you all their names, but there are simply too many. Over the course of this program, we will show you what our time allows. We will remember them. And as you do too, I want you to listen how the president started this day, a day that will likely go down in history. 200,000 dead.
And we've done a phenomenal job, not just a good job, a phenomenal job. Other than public relations, but that's because I have fake news. I can't, you can't convince them of anything. They're fake. But we have done, on public relations, I give myself a D. On the job itself, we take an A+ with the ventilators, and now with the vaccines that are years ahead of schedule.
Phenomenal job, he says. The list says otherwise. Nearly 200,000 dead, and the number will go up. Other than the 1918 pandemic, the Civil War, and World War II, this is the single largest loss of life in the entire history of the country. Many, if not most of the deaths, were preventable, using tools and methods that this country, scientists in this country, we ourselves pioneered and taught to the world. What the president is teaching now to the country and the world is how to spread disease and death. Yet another rally, this time in Ohio, the crowd booing when Ohio's lieutenant governor tried to encourage them to put on masks. They actually booed the lieutenant governor for encouraging them to put on masks. Months of watching the president has, I guess, trained them well. Seeing him mock the idea, watching him go without a mask, some perhaps not knowing just how protected he really is inside his biological bubble, his biological bunker, or how unprotected he is willing to let them be. And it's no accident. CNN has reviewed internal documents detailing a plan by the Department of Health and Human Services to mail out 650 million reusable face coverings, 5 to a pack to every household in the country. That was the plan. It never came to pass. An administration official telling the Washington Post that the White House squelched the idea out of concern, the official says, about creating a panic. That was back in April, and the notion dovetails neatly with what the president told Bob Woodward just a few weeks before that.
I wanted to always play it down. I still like playing it down.
Yes, sir.
Because I don't want to create a panic.
When he said that, 3,400 Americans had died. By the end of April, as the mask plan was debated and discarded, the death toll rose from 6,300 to 65,000. Another 165,000 have died since then. So think how different that might have been if the president had gotten behind the plan, had encouraged people to wear masks. Instead, he was fatalistic, was already on record as far back as late March talking about deaths in the millions and willing to claim victory for less than 200,000.
If we can hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
Well, just think that was in March. Think of everything else he has done and not done as the death toll rose. He's pushed unproven drugs and pressured the FDA commissioner to publicly tout a treatment so lavishly that he later had to apologize. The FDA commissioner, of course, not the president. He doesn't apologize. He's leaned on states to reopen against CDC guidelines. The administration has pressured the CDC to loosen guidance for reopening schools and testing people who don't have symptoms but have been exposed to people who tested positive. First it was yes, then it was no. Then on Friday, it was quietly changed back to yes. And just today, a new CDC warning was pulled from the agency's website. It detailed what many researchers already believe, that COVID-19 lingers in the air in a kind of viral fog. Well, now it's gone from the website. A federal official saying that it was posted to the site in error, that someone at the CDC pushed the wrong button. It would be laughable if it weren't so tragic. They also said there was no political pressure involved in the change, which would have been easier to believe before this pandemic, before the kneecapping of Drs. Fauci and Birx and the CDC's Redfield, before hospitals were told to bypass CDC and send all their case and mortality data straight to the administration, before we learned just today that the CDC, the FDA, and others will now have to submit any new rules to the administration to be signed off on. And throughout it all, including now with the death toll about to pass 200,000, the president has been giving himself A-plus grades, saying he's done a phenomenal job, and of course, always moving the goalposts.
It's one person coming in from China, and we have it under control.
Of the 15 people, the original 15 as I call them, 8 of them have returned to their homes. And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to 0, that's a pretty good job we've done. But we're going toward 50 or 60,000 people, 80 or 90, and it goes up, and it goes up rapidly. Look, we're going to lose anywhere from 75, 80 to 100,000 people. If we can hold that down, as we're saying, to 100,000, it's a horrible number. So we have between 100 and 200,000. We all together have done a very good job.
Joining us now, CNN Chief Medical Correspondent Dr. Sanjay Gupta and Dr. Craig Spencer, who's been dealing with the consequences of all this on the front lines at the Columbia University Medical Center here.